Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang inisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates, so it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really, like Simply Nature, that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Hello po, ako nga po pala si Ronaldin Rosales Batalier, 23 years old at ako po ay taga Bicol, Albay. Na-diagnose po ako nung taong 2015, which is ito po yung mixed germ cell tumor sa ovary. Stage 1 po ako nung diagnose ako. Tinanggal po agad yung right ovary ko noon. May nakakita sa akin na taga doon sa amin, sabi niya, what if try ko daw sumali ng contest? Tapos hindi ko nga sinabi na may sakit ako. Sabi ko, sige, baka sakaling kahit paano may pandagdag kami sa gastos namin. Then noong 2017 po, yun na po, pabalik-balik yung lagnat ko. Siguro mga 2 weeks hindi ako nawawalan ng lagnat. Tapos yun na, pagpa-check up ko kasi lumaki po yung tiyan ko. Doon ko po nalaman na yung cancer ko daw, numerous to count na siya. Yung sakit sobra pa, yung nararamdaman ko, likod and sa stomach ko. Ganun po lumaki po yung tiyan ko, hirap na hirap po ako. Nagawa po yung nakalatan na din yung lungs ko. Yung sa liver ko, kaya daw po lumaki yung tiyan ko, gawa ng sa liver po. Hindi na masyado nagpa-function yung mga organ ko sa loob ng tiyan. Yun po, ni-repair na po kami sa child house. And then, nung start na nag-chemo ako, doon na po kami tumira. Nag-stay na po sa child house. Akala ko okay na, wala na mangyayaring operasyon ulit. Pero nagulat po ako kasi every monthly check-up na lang po ako. Umuwi lang po ako sa amin tapos nagsusuka na naman ako. Akala ko kung ano na naman po yun. Yung dumi na ilalabas ko sa bibig na. Sabi ko, ano na naman to pa? Kaya na naman tayo, sisimula na naman tayo. May nakita daw po ulit na bukol sa diaphragm. Iyak na naman po ako. Sabi ko, hindi pa nga magaling yung sa ibang organ ko. Tapos ito na naman. Po as of now, wala na po akong treatment and may tumor pa po ako sa diaphragm. And lately, may nakita na naman daw po sa akin ng gallstone sa may gallbladder ko. Napansin ko po talaga, start po uminom ako nung Simply Nature, which is yung powder and tablet po na PPARs. Para pong, pag nainom ko na po siya before ako matulog, pag nakakainom po ako na parang nare-relieve, parang nare-relax po yung katawan ko. Siguro mga 2 days after na take ko po yung gamot, parang napansin ko na parang everyday na ako nagbabawas. Kasi po talaga dati, siguro sa isang linggo, 3 beses lang po ako nagbabawas. And nakita ko po talaga yung good feedback agad ng gamot na ininom ko. Kasi yun nga po, parang pag nainom ko po siya, parang yung sa loob ko na may something ako naririnig na tumutunog. And after yun po, nagbabawas na po ako. And parang ang gaan po sa pakiramdam. And parang medyo po nabawasan yung bloated ko sa tiyan. Start po nung uminom po ako. About po dito sa PPARs powder po, tinitake ko po siya every after meal. And based sa protocol po na ibigay po sa akin ni Doc Jansen, pag morning, which is 5 scoop, nilalagay po sa ilalim ng dila, and antayin mo po yun matunaw. Pag gabi naman po, tinitake ko siya after dinner, which is 4 scoop naman po siya. Kasi sa protocol po is kailangan everyday makatake ako ng 9 scoop. So, kapag po, based po sa observation ko, kapag po naiinom ko po itong PPARs powder,
Parang yung something na tumutunog po talaga sa tiyan ko, na parang may something, parang kiniklense na yung sa loob ng tiyan ko. And after po nun, magbabawas na ako. So parang after ko pong magbawas nun, parang feeling ko sobrang gaan ng pakaramdam ko sa tiyan ko. Tungkol naman po sa PPARS Plus tablets naman po, based sa protocol po na ibinigay po sa akin ni Doc Jansen, ano po siya, kailangan everyday makatake po ako ng 30 tablets. So sa protocol po na sinusunod ko, iinumin ko po siya with empty yung stomach ko. Pag morning, pagkagising ko, ito po talaga agad yung iniinom ko. 15 tablets sa morning, and after naman po, same, kailangan empty din yung stomach mo. 15 sa morning, ng pagkagising ko, and 15 sa evening after dinner ko before ako mag-sleep. Kasi yun nga po, mas pinipili ko siya after dinner na lang po siya inumin para po agad, pag nainom ko po siya, yun nga po, nare-relieve yung katawan ko, parang mabilis po ako nakakatulog, and naiiwasan ko po yung insomnia na lagi ko pong nararanasan noon po, lalong-lalo na po nung after po ako mag-chemo. So yun. Daily routine ko, yun, gumigising ako ng umaga for exercise kasi yun din yung advice sa akin ng doctor ko. Kailangan may regular exercise ako and pagkain ng mga masustansya pagkain. And yun nga po, nabanggit ko last time na mahilig talaga ako magluto. Yun po talaga, kapag kumakain po kami sa office, talagang ako po yung luluto po para sa pagkain po namin ng ibang mga kasamahan ko pasyente. As of now, thankful po ako kasi isa po ako sa nakatanggap ng scholarship sa isang magandang universidad dito sa Manila. Isa po sa nag-udyok sa akin para kumuha ako ng kursong education is yung mga bata po na kasamahan ko dito. So, nakikita ko po yung hirap ng papa ko. So, sinasabi ko sa sarili ko na hindi ako kailangan panghinaan ng loob. Kasi yung papa ko, nilalaban niya ako eh. Pero ako that time po kasi kapag naiisip ko yung taning ko, parang ang sakit po. Like, nakikita ko yung papa ko na lumalaban. Pero yung katawan ko, pakiramdam ko po kasi sumusuko na kahit yung utak ko, yung puso ko gusto ko lumaban. Hindi matutumbasan ng pasasalamat yung nagawa sa akin ng papa ko kasi talaga sobrang bait ng papa ko.
And nung November po is nag-CT scan po ako. Doon ko po nalaman na may nakita daw po na bagong tumor po sa akin. So that time, syempre, naisip ko na okay na ako tapos may nakita na naman po ulit na bago. So I am so thankful po kasi nung December po is nakilala ko po kayo. Nakilala ko po sila Mr. Shyan, sila Doc Jansen po at ang Simply Nature staff po na alam ko pong nakatulong po talaga sa akin. And yun nga po, nung nakita po na parang bad yung result ng CT scan ko, and after po ng December, bali po after December po, and until June, July, bali nakatatlong CT scan po ako. At nakita ko po talaga yung improvement po ng result ng CT scan and ultrasound ko po. And I'm so happy po na nitong latest na CT scan ko nung July, tuwang-tuwa po si Doc Jansen kasi talagang nakita po niya na lumiit po talaga yung tumor ko. And masayang-masaya po ako doon. Siguro kung wala yung Simply Nature, siguro yung tumor na nakita po sa akin, I think siguro po mas lalala po siya. Kasi yun nga po ang sabi nila, kapag na-stress yung pasyente, mas lalo po yung nagtitrigger yung cancer po. Kaya yun nga po, maraming salamat po talaga sa Simple Nature kasi kung hindi po dahil sa inyo, siguro hanggang ngayon stop pa rin po ako sa pag-aaral. Ngayon po, gusto ko lamang po pala ipaabot ang aking pasasalamat kila Doc Jansen and Mr. Shyan. Maraming salamat po talaga kasi alam ko po talaga nakatulong po siya sa akin at alam ko pong mas lumakas po ako. And sabi nga po ni Doc Jansen na kahit slowly siya, sure naman po talaga na gagaling po ako. Kaya maraming salamat po sa walang sawang pag-support po sa akin.
Good evening to our attendees for tonight. My name is Jessa and you are watching another episode of Simply Nature webinar powered by SMG or Simply Healed Medical Group. Last Thursday, we discussed multiple ways on how to beat cancer naturally. Today, we will navigate on a journey of knowledge sharing, collaboration, and awareness as we strive to enhance our understanding to chronic kidney disease, a condition that affects millions of lives globally. And by coming together in forums like this, we strengthen our collective efforts to combat its impact on individuals and communities. Before we start to provide valuable insights and greetings to our attendees for tonight, we have here an international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International. Our PR expert from Singapore, you all know him, no other than Mr. Shyan Lim.
Thank you, Jessa. Thank you for that wonderful introduction. A big hello and welcome to all our viewers. This is am I correct, Jessa? This is the second week of the new year, right?
Yes,
It's
sir.
our second program. And thank you, everyone. Tonight's attendance is already so good. Such a big crowd even before our program started. I think tonight's program is very important because the topic is about CKD, chronic kidney diseases. It's a little different from our usual topic of cancer, but this one is really, really important because it affects the quality of life. And CKD, chronic kidney diseases, is becoming more and more rampant. Even if you are a cancer patient, this is something that you cannot ignore, because if your kidney is weak or your kidney is damaged, it severely limits your options for treating cancer. It affects the type of chemotherapy you can go through. It also affects the effectiveness of your recovery after you go through chemotherapy and radiation or any other therapy, including surgery. So it's a really great topic to start the second week of the new year with. And don't forget, we have a very short discussion with Dr. Jansen, something like 11 minutes. And then we'll move to the most interesting part of our program on every Thursday, which is the Ask Me Anything segment. So feel free to ask any questions that you come to mind. It could be off topic. It doesn't have to be about CKD. It can be about cancer. It can be about any other health ailments. It can also even be, if you want to ask Dr. Jansen what he thinks the stock market will do this year. No, but kidding aside, we're very excited to hear your questions about your medical conditions. So without further ado, I'll hand the time back to Jessa, who will introduce Dr. Jansen, who will share with us tonight. Thank you, Jessa.
Okay, thank you, Sir Shyan, for your powerful greeting to our crowd tonight. Moving forward, let us all watch this.
Hi everyone, welcome to another episode of Simply Healed, and we have Dr. Jansen with us again tonight.
Hello, Shyan. Hello, everyone. Welcome to another Simply Healed webinar.
And tonight we're going to talk about chronic kidney diseases. This is still so important, Doc. All over the world, be it in the Philippines or Singapore, one of the most common charity events is to raise funds for kidney foundations, because dialysis is such an expensive treatment, and it's lifelong, and it's so difficult. So chronic kidney disease, that is something that every one of us face, right? So maybe you can share with us tonight what are some of the common causes of chronic kidney disease so that we don't end up with dialysis in our life. Okay. Go Doc.
All right, so our topic for today is CKD, treating CKD the natural way. Okay, so I won't be talking about hypertension or diabetes here, all right? So in and of itself, okay, what causes the decline in kidney function? It's the food you eat, okay? So there are 3 dietary risk factors for the decline in kidney function. Number 1 is animal protein. Number 2 is animal fat. Number 3 is cholesterol. Okay? So how do
these 3 work?
Okay?
Yeah.
So how does these 3 destroy your kidneys? Okay, number 1, let's discuss about animal protein. Okay? Animal protein causes inflammation. Okay? So the inflammation is the one that destroys your kidneys. It causes a decline in kidney function. Aside from that, it destroys the integrity of the kidneys, the structural integrity of the kidneys. So all of you know, the kidneys is a filter. Okay? So imagine
you pouring acid onto the filter. What will happen? It will melt it down, okay? So it won't act as a filter anymore, okay? So those are how animal protein causes a decline in kidney function. And also, animal protein increases the acidity, okay? Increases the acidity of the blood. So once your blood is very acidic, yeah, it destroys the structural integrity of the kidneys as well. Okay, so later, I will show you which food are
Has
more
the highest
alkaline or
acidity.
the highest acidity. This one will be very interesting for you, I'm
Yeah,
sure.
some of us are eating what we thought was the safe meat. Oh no, but it's actually the most acidic. All right.
Okay? So just to give you a clue, okay? Animal protein, all animal protein are acidic. Okay, so those which are alkaline are plant foods in general. Okay, so you don't actually see a decline in kidney function when you eat plant foods or when you eat plant protein.
Yeah, Doc, that's the next question I wanted to ask. What's the difference between plant protein and animal protein?
Okay, this is getting too technical already.
But just a simple-
yeah, just a simple. There is a specific amino acid found in animal protein that is not found in
Plant protein.
Now, once you ingest that amino acid, that is the one that causes these wrecks. Okay, yeah.
And it does that by inflammation.
Yeah, it does that through inflammation. And how do we know this? Okay, that animal protein causes inflammation that leads to decline in kidney function. So they did an experiment. So two groups. Okay, so the control group, they fed these people. The scientists fed them with eat all you can animal protein. Okay, so
Eat all you can meat buffet.
yeah. Okay, so after eating, they measured the kidney function. Yeah, they saw a decline in kidney function. Okay, just what we expected. Okay,
So you eat meat, your kidney suffers.
yeah, eat meat, kidney suffers. But on the experimental group, after they eat meat, they gave them an anti-inflammatory drug and measured the kidney function. They did not see a decline in kidney function. So
So the anti-inflammatory drug controlled
Controlled
the
the
inflammation
inflammation.
caused by the meat.
yes,
So the kidney function normally.
So the
Oh.
kidney function was not affected. Okay.
Doc, that means those of us or those of you who are eating meat, PPARs helps manage inflammation.
Yes.
So eat more PPAR tablets. You're saving your kidney.
Okay. Now, I think some people here. Okay, let's go to a buffet. Let's go to Vikings. But before we eat Vikings, let's take one tablet of ibuprofen or one tablet of anti-inflammatory drug or pain reliever.
Or 15 PPAR
15 PPAR
tablets.
tablets, yeah. Okay. 15 PPAR tablets you can eat because it's food, but be careful about the drugs, okay? Because these anti-inflammatory drugs, if you keep on taking them for a long period of time,
Damage your liver.
it can, the liver, but a more immediate effect is it can give you ulcers, gastric ulcers,
then
stomach
that's
ulcers.
another problem.
So that's another problem.
That's another problem.
Which can perforate your stomach.
Yeah, and when
In
you
the long
come,
run.
when you have to stop taking it, that perforation will cause complications that
Yeah.
might lead to stomach cancer.
Morbid. It's a morbid.
Yeah,
it's
so
really bad.
don't do that.
Don't
Take
do
your
it.
PPAR tablets.
Okay? Don't
and
do
best stop eating meat or
Okay?
not so much meat.
Yes, correct. So next one is animal fat. Okay, so how does animal fat destroys the kidney? Okay, so it basically causes the blockage of the blood vessels. Okay, so it makes your blood more sluggish. So if it's more sluggish, then it doesn't flow as well. So the viscosity of the blood can destroy the structural integrity of your kidney as well. Okay, and of course it would be more difficult for the kidneys to filter out the waste products. Okay?
Because it's more
Yeah,
viscous.
because it's more because so just imagine.
Yeah.
Yeah, imagine at your house you have a water filtration system,
And
and then what? Suddenly, the water
You
service
put mud.
company,
you put mud in.
there's a lot of mud in the water service
You're
company.
gonna clog up your. You're gonna clog up your
Yeah.
filter.
Yeah, what do you think will happen to your filter? Okay,
That's
so
what's
it's the
gonna
same
happen to your
concept.
kidney.
Okay, it's the same concept. Okay, so number 2 is cholesterol. Cholesterol is basically the same as animal fat. It clogs up the arteries. So if it clogs up, less blood flow. Okay, same thing. Less filtration that's going to happen. Now, this is where this is what everybody's been waiting for. Doc, which food is really acidic and which food are alkaline? In
Yeah,
nature?
because Doc, I think it's common knowledge. Everybody knows acidic. Having an acidic body is not good. Makes you tired easily.
Yeah,
You
exactly.
don't recover from your soreness longer. So yeah, Doc, which food is most acidic?
Okay, take a look at this image. Fish
Wow.
is the most acidic.
I
of
thought
them
that was
all.
the same. Oh my god, this is like number one, right? Pork is the. We always think pork
Number
is
two.
better than beef, and then we thought fish is better than pork.
Yes, yes.
Oh my god, and we thought chicken is better than beef because it's a white meat.
Yeah.
Oh, but they are the most acidic. Oh my
But
god.
contrary to popular belief, no. Okay, so if you are someone, if you are watching, no, if you are someone with chronic kidney disease, you are diabetic, you are hypertensive. Okay, so hypertension, diabetes is the two most common risk factors or the major risk factors to developing chronic kidney disease that leads to dialysis eventually, no? Okay, so do not eat fish, please. Okay, do not eat fish. That will have a bad effect on your kidneys. Okay, I would rather you eat that beef rather than you eat the fish. But of course, beef has its own problems. as well.
right?
So-
So the best is the green veggies
Yeah.
on the other spectrum.
Yeah, on the other spectrum, on the right, okay, on the right aspect, these are the better choices.
No, I did notice that bread and rice is also slightly acidic.
Yeah, slightly acidic, but there are more on the
Neutral.
neutral. But take a look. Bread and rice, what do they have in common? These are moderately processed foods. Well, how do you get white rice? Yeah, you remove the
You gotta
husk.
polish
You
it.
polish it, right? You remove the fiber.
Yes.
How do you get bread? You need to have flour first, okay,
Mm.
before you can make it into bread. So these foods are moderately processed. Fiber has been already removed from these foods. That's why it has
one more acidic.
this neutral effect. Pasta is the same, okay? But take a look at the beans, the fruits, and the veggies.
Wow.
Okay,
Big difference.
Big difference. They give you the most alkalinizing effect. It's because they are whole foods. It's just like Simply Nature pea bars. Yeah.
That's why you take Simply Nature
Yeah.
Pipan tablets.
Yeah, it's made out of microalgae. That's why it gives this profound effect. Now, if you are worried about your omega-3, hey doc, isn't it fish is very rich in omega-3 fatty acids? That's why I need to eat fish. No, okay? Aside from eating, there are also bad effects. So if you want to get the benefit of the omega-3s, go for the microalgae. That is where the fish gets their omega-3s in the first place.
That's
anyway.
right.
Go
Get it.
straight to the source.
Go straight to the source.
Microalgal omega-3s is superior always to the fish omega-3s, and also it's more safer than to the environment. Okay, that's basically
all.
the message.
That's
Yeah.
all the message. I'm sure there are a lot of questions right now about that you may have about dialysis. If you are already on dialysis, what can you do? Can it be reversed? Kidney damage is often not felt until it's almost too late.
Yeah, often, more often, yeah.
More often.
usually.
So
Yeah.
don't assume that today, if your kidneys are fine, that you have no problem, that you are safe. Always, as especially for me, I'm gonna celebrate my 50th birthday very soon in 2 years' time. I think I'm having more and more motivation to make sure that I go plant-based so that I don't have all these problems,
Yes.
right? I
Yes.
don't want to be 55 and having to go to the hospital.
Yeah.
That I should be enjoying my life,
Mhm.
right? You should be working really hard, but I should be enjoying
Oh,
life.
do you know?
Yeah.
Do you know that the lifespan of humans is actually 120?
Yes,
Yeah.
that's
So,
amazing. The telomeres,
60?
right?
60
60
years
is
old?
halfway. You're halfway there.
It's
only.
the middle age.
Yeah. I'm gonna prove it to all our viewers. When you see me when I'm 60, I will look pretty much the way I look today. All right. So
Yeah.
that's my goal. Hallelujah. So I see the questions coming up. Let's move to our AMA Ask Me Anything segment.
All right, that was an informative video presentation about chronic kidney disease. Now it is time to hear from another expert with the help of his expertise. He is a graduate from St. Luke's Medical Center College of Medicine. He is a diplomat of the International Board of Lifestyle Medicine under the Philippine College of Lifestyle Medicine. He's also an integrative medicine doctor, the medical director of Simply Healed Medical Group, and consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas, where he manages patients with cancer and metabolic illnesses. Let's all welcome Dr. Jansen Calalan.
Hello, Jessa. Hello.
Hi,
Yeah,
Doc.
hello, Jessa. Hello. Hello,
you
Sean.
were you were
Yeah,
stunned for a moment because we have
there
so
was
many talented hosts.
yeah, the host, our host keep changing. Anyway, hello everyone. Hello everyone. No, happy to be here. Welcome to our viewers.
All right. Today's topic is a very important topic, and it's so nice in the beginning of the year. We talked about breast cancer last week, and today kidney diseases. This is one of the growing, I guess, concerns. Many people, especially those who are slightly older, are very concerned about this. Yeah. So let's go to our questions straight away. Jessa?
Okay. Thank you, Sir Sean and Doc Johnson. I am thrilled to have such a big and interactive audience tonight. I can see here from the screen that questions start to line up. To our attendees, please feel free to put your questions at the comment section below and let's keep the conversation going. Okay, for our first question tonight, what would be the best diagnostic and management for high creatinine?
Oh, that's a good one, Doc.
Yeah, very good question. No? So first of all, if your creatinine is high, we have to know if you really have a problem with your kidney. Okay, so the best diagnostics that we should get is, of course, to get your blood check. Okay, take a look at your risk profile. So do you have high blood pressure? What's your lifestyle? What the diet that you're eating as well? Okay, exercise or heavy exercise can elevate creatinine. However, with heavy exercise, it doesn't mean that it damages directly the kidneys. Okay, um, prolonged, strenuous, vigorous physical activity is the one that can elevate creatinine and of course can result into kidney damage, acute kidney injury, no? So that's the one. So by strenuous and vigorous exercise, it is such an intensity where you see muscle damage already. Okay? And not just intense exercise, no? Or prolonged intense exercise, not just that even when we martial artists, okay, martial artists, what they engage in combat sports. So when you hit somebody, when you hit someone, the muscle of that individual can get destroyed, and with that, no, there will be a drastic increase in the creatinine, okay, which can result into acute kidney injury. Okay, so that's one. Now, if your kidney injury is because of your lifestyle, no, you are hypertensive, you are diabetic, okay, your diet is not good, then that can lead to chronic kidney disease. Okay, if your serum creatinine is elevated for a very long period of time. But we don't just look into creatinine. We also have to look into your BUN or your blood urea nitrogen. Okay, that's a waste product that your body generates and should be excreted through the urine. Another one is the amount of protein that can be found in your urine. Okay, if you have proteinuria, okay, if you are peeing out your urine, then that is also a sign that you might have kidney damage. Okay.
Thank you, Doc Johnson. So we also have another question here from our viewer tonight, Miss Zari. My question is, my brother was diagnosed with kidney disease and the doctor said he could only eat tilapia and bangus. So you've said fish is not allowed to be eaten?
Wow, that is Doc. That's like a complete opposite of what a doctor
Yes.
said. So I
Okay.
think you will need to give a more in-depth
Yeah.
explanation.
Okay, I'll explain. No, but to be fair, no, please ask your brother to ask his doctor why fish is the one that he or she recommends. Okay, but on my part, this is the explanation why I don't recommend any animal food products. Okay, for chronic kidney disease patients. Number one, fish. is the most acidic um, food food source. Yeah, it's actually the most acidic food source
Yeah.
that can be found in the market. Number two, fish is heavily laden with heavy metals. Okay, heavy metals will damage your kidney. And what is the function of your kidney? It's to excrete. So your heavy metals will have nowhere to go but through your urine. If you have impaired kidney function, heavy metals will accumulate inside your body. Okay. Number three, animal protein in and of itself causes inflammation to the kidney. There are a lot of studies about this already, wherein they look at um, serum creatinine, okay, and the microalbuminuria. Okay, so the amount of albumin that your kidney excretes. Okay, this is protein. All right, and they found that when patients consume animal food products, albuminuria increases, meaning kidney function declines. And immediately when they shift the diet to a plant-based diet, zero animal protein, okay, vegetarian diet, no, the albuminuria decreases. This means that the kidney function improves. Okay? So that is the explanation why I always tell patients not to consume animal food products when you have chronic kidney disease. On top of that, okay, for patients who have chronic kidney disease, the recommended protein is only 0.06 to zero point 0.6 to zero point 0.8 grams per kilogram body weight per day. Okay? And animal food sources are very high in protein. Okay? So the more protein that you consume as well, that will also um, damage your kidneys further. All right? So I don't know, please go back to your doctor and ask why fish is the one that your doctor recommends. Okay?
You know,
But this is the explanation.
Dr. Jansen, what you said makes absolute sense. I think what's important, many viewers, when you watch our program, you will be finding like, wow, it's different from what I hear from my doctors.
Yeah.
So, right, Jessa, we sometimes share very interesting information. So, I always encourage all our viewers to develop your ability to reason, right? Your ability to choose correctly so that you won't just, I guess, listen to a person simply because they are a doctor. You know what makes sense and what does not make sense. So we all know that when we eat fish, this is true, doc. We are always worried about mercury poisoning, even when we eat salmon. I think for salmon, that's one of the most common things that we're all worried about. And of course, for fishes that are caught in the ocean, right? Heavy metals is something we are very worried about. And for those of you who think about fishes that are cultured, in what we call fisheries, many fisheries are actually positioned in the open ocean, but the fish are not allowed to swim around freely. They grow up in nets, but the fishery is still in the ocean. And the boats go by, they dump their petroleum, all that. So that's another real reason why it is true that fish tend to have high and heavy metals, and it's a big concern when it comes to seafood. Doc is also absolutely right about seafood being acidic, because my wife, my father-in-law used to work at the fish market. So their whole family ate fish all the time. And you can tell their physical condition, it's a lot of it is symptoms of a high acidity in their body. So all these things that Dr. Jansen said is easy to understand. And with those things, it makes it quite easy and clear why a CKD person should not be eating fish. Especially bangus and all these fish, a lot of them are also cultured fish. So they're also full of antibiotics and all that, and that has to be pumped through your system as well. So that's why I guess at the end of the day, eating more vegetables would be the best solution. And if you're worried about protein, many plants like legumes, peas, green peas, mungos are very rich in protein as well. So that should be sufficient for your diet. Yeah. I hope
Thank you so Okay. Go ahead, Sir Sean.
Oh yeah, I saw Jing asked, what about eating shrimps? Okay, you can see Doc Johnson's face. He went, okay.
Okay. Don't uh don't fool yourself, okay? Shrimp is a bottom feeder.
Which is
So all
worse.
yeah, it is actually worse compared to fish that are swimming because heavy metals tend
Sink.
to sink to the bottom of the ocean, okay? So shrimp is worse. So and of course no, if you have CKD, come on, please don't eat these foods. Shrimps are also quite high in cholesterol, and you do not want dietary cholesterol. You want the cholesterol that you want your liver to produce all the cholesterol your body needs. So anything in excess of that is just going to accumulate inside your arteries. And if you do accumulate arteries, no, if you do accumulate cholesterol inside your arteries, maybe one day you'll go to my clinic and see me. I'll be happy to see you.
Okay.
Uh,
Yeah, well, I think, sorry, Jessica, sorry to interrupt you because I see
oh,
another one that is connected to this, Like, so guys, very, very important. It really makes a big difference, the foods that you eat, okay? Just to share with you, um, I had I was suffering from high blood cholesterol. Even yes, I know the PPAP protocols are really good for blood cholesterol, but there's a reason why even though PPARs is so good for blood cholesterol, I have very healthy triglycerides. It's perfect. When the blood test came out, it's optimal. Okay, which means very good. And my cancer markers, all these are really, really good. But I had high blood cholesterol because of the amount of butter I eat. Okay, yeah, Tom Johnson heard it and he was like, "What? Those pre-packed butter, right? The small little rectangular one. Isang, one pandesal, I'll eat four butter for one pandesal. So you can just imagine. So I do that daily. So one stick of butter I can finish in like 2-3 days. So it's really terrible. And I've been doing that for like the last 3 years, especially during the COVID lockdown. I have a lot of butter with my bread. And I like to eat things like crepe, and I put a lot of butter, croissants, I put a lot of butter on that. So really, really bad. So in order to bring my cholesterol down, you know what? I have just in the last 1 month, I have lost about 11 pounds. Okay, and I've been just eating vegetables. I dropped my meat by 90%. 90. I still eat very little, but very little, 90%. And I feel lighter. Everything is clear. My blood pressure came down. My hypertension came down. I'm waiting to go and do my blood works. I'm sure my cholesterol has dropped by a tremendous amount. Right? I still enjoy very good food, right? It's just that my choices are very careful now. So the foods that you eat, yeah, if you watch what you eat carefully, you can still enjoy your life. You won't even need medication. So I think this is something that for all the patients and viewers who ask this question tonight, no, take it seriously. Just cutting out certain foods for a good amount of time, maybe 3 months, 6 months, until everything normalizes, will save your life, right? And you don't have to go through all that pain. Oh, I see, Doc, a lot of questions like, what about chicken meat? So then we're gonna go to all the one. What about all sorts of meat? So before Doc Johnson answer, I'll just share with you what I did. Okay, I know it's really difficult to cut completely. So like I said, I cut my meat intake by 90%. All right. So most days I don't even eat meat. And after 1 month, it's been more than a month. I still enjoy meat when I eat it, but I don't find a huge craving for it. That means if I don't have it, it's okay. If I have it, I enjoy it. And this way, I don't have to eat a lot, right? Okay, so Dr. Johnson, what do you have to say about patience and meat?
No, okay, for CKD, again, no, I'll repeat, animal food products. So any food that is sourced from animals, don't eat them. Okay? If your food has a mom or it came from a mom, don't eat. Okay? Simple as that. Eat only foods that is sourced from plants. Okay? So I think that's easy to understand.
Yeah, and do this until your condition improve. Okay, it's not saying that for the rest of your life you won't eat it, but at least while you're still tackling this CKD, watch what you eat. Doc, so I think related to this question is this, Doc. Is CKD stage 5 reversible?
No, 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 no. Okay, so if I think okay, I'll answer a few. Okay, my answer would
already answer. Okay, a few questions that I think that we have. No, okay. If you're thinking about reversibility or recovering from CKD, if your CKD is stage one, stage two, then yes, it can be reversed. If it's stage three, it's very difficult. If it's stage four and five, it's impossible. Okay, we can
So
only we can only prolong the time that you are free from dialysis, or try to delay dialysis basically. Okay.
So that's why everyone don't allow your CKD to get worse. So manage your food cravings just while you're trying to correct your CKD, right? Now of course, doc, I just wanted to inject this. Whenever a doctor or even myself or researcher says something is impossible, what we mean is under normal conditions, the chances of recovery is like next to zero. Okay. Of course, in life, there is always the super outlier, right? There are people who were pronounced dead and then came back to life because there was a unique medical condition. And yeah, we have cancer cases which are so advanced, yet the person can turn it around. So, of course, that always lies in the realm of the small and miraculous. However, when we are talking to you, the viewers, we definitely want to paint the most realistic picture so that you also don't allow yourself to get to that irreversible stage. All right. So yeah. So kidney diseases have a chance to reverse. There's always a chance. But when you reach the later stages, that chance becomes so small that for all intensive purposes, most doctors will tell you it's irreversible. But of course, if you come to us and say, Doc, I have stage 5 kidney, I want to do whatever I can do, then we will tell you, come, here is the best protocols that you can do. I know it will at least prolong, and you never know. We lift it in prayer. Anything can happen. But that's not how we want to allow things to get so bad. All right? Okay. Jessa, next
Okay.
question.
Thank you, Sir Sean and Doc Johnson. I agree with you. I agree with you guys regarding on the mindful eating when it comes to your lifestyle change. And if ever you have a medical condition, it is really important to become mindful on what you eat. And yes, for our next question, apart from a food question and lifestyle related questions, I think this one is a great question also from our viewer from Zamboanga. Is vitamin C, gluta, and collagen drip not fatal to our kidneys?
Oh, that's interesting.
Yeah, if done right, it won't. If done right, okay. Vitamin C drips, I do IV vitamin C, at very high doses. I haven't seen a patient that suffered from kidney damage. Creatinine is always perfectly normal. Yeah. However, if you have elevated creatinine already, then you want to undergo vitamin C drip, then we cannot do it. Especially if your creatinine is above 2. All right. There's a high chance that you can form kidney stones already because you have impaired kidney function. Okay, but vitamin C will not cause kidney damage. It will not cause kidney stones to occur as well. Okay. Glutathione, same. Okay, we do not mix glutathione and vitamin C together. Okay, especially high dose of vitamin C because they counteract each other. All right. So if you are someone who is undergoing glutathione drip, it's okay. It won't damage your kidneys unless the one that they gave you is adulterated. Okay. By adulterated, it means that the medicine that they gave you has impurities. Okay, then that's the then that when that if it's the case, then it can happen. Okay. And lastly, collagen. Collagen drips are fine. It won't cause kidney damage as well. Okay.
Thank you, Doc. Another question from our viewer for tonight. If the patient prescribed by the doctor taking Sevillmere, is it considered he/she is suffering CKD already?
Okay, sevelamer is a medication that is used to reduce phosphorus absorption from your gut. Okay, CKD patients typically have elevated phosphorus levels. Why? Because phosphorus is excreted through the urine. And why is elevated amounts of phosphorus dangerous for our body? It's because phosphorus, no, our body, okay, to excrete that, to excrete the excess amounts of phosphorus, our body gets calcium to bind it together with phosphorus so that we can excrete out phosphorus. And where do our body get calcium? Your body will get calcium from your bones. Okay, so that's why CKD patients with elevated phosphorus levels also is at an elevated risk of developing osteoporosis, which of course we do not want. So, sevelamer is a medication to reduce the absorption of phosphorus from the gut. Okay, so that is the mechanism of action. Right. So if you are someone who is taking, or if your nephro prescribed you with sevelamer, number one, it means that you have elevated phosphorus levels in your blood, and the goal is to reduce phosphorus levels. And if you have elevated phosphorus levels already in your blood, then most likely then you have problems with your kidney. So yes, you might have CKD already, but of course, acute kidney injuries, um, elevations in phosphorus can also happen. Okay.
Thank you, Doc. For the next question, this was sent by privately by our viewer tonight. What are the other alternative treatments for CKD other than dialysis? What are the supplements that you can recommend, like incorporating
Okay.
PPARs in my medication?
Yeah. Okay. So, very good question. Wow, we have wonderful questions tonight.
Yeah, I think
Mhm.
this question is especially good because it's a solution question, right? People are asking
Yes, yes,
to
yes.
solve this. Yeah.
Mhm. Now, for CKD patients, no, I address the problem in a number of ways. Okay, so number one, what is the root cause of the CKD? So the most common
Mm.
ones would be hypertension and diabetes. So we have to correct those two. Your blood pressure should be normal. Okay, so guidelines tells us that a patient with CKD, the blood pressure should be less than 140 over 90. Okay, so you have to be on blood pressure medications for that matter. And okay, your medications, the synthetic medications that is being prescribed by your doctors for your blood sugar, for your blood pressure, will not damage your kidneys. Okay, that will even prolong the amount of time that your kidney remains healthy, and prolong initiate or delay the start of dialysis. Okay, so please take your medications. Okay. Same thing with diabetes, no? So diabetes meds like your dapagliflozin, canagliflozin, your metformin, so your the other ones, no, they won't damage your kidneys. Okay? They will even protect your kidneys. Okay, so please take them. All right? So another one, so we address the root cause. Another one is to prevent further injury to the kidneys. Okay, so we're addressing this factor, so that's actually under that principle as well, no, preventing further damage. So what do we do? Food. Okay, so again, animal food products, animal protein, um, foods that are very high in fats, especially animal fat, will damage your kidneys. That's highly inflammatory. Okay, the fats that you want are fats that is sourced from plants, like your avocado oil, your flaxseed oil, your microalgae, okay? Yeah, seeds as well, okay? So these food items are the foods that you want, okay? Another one is to try to stimulate um, recovery of the kidneys. So by doing that, that is when I prescribe PPARs, because PPAR agonists can stimulate cellular differentiation. So meaning it can stimulate the stem cells inside our body to replicate, okay, to heal the body, to heal whatever is damaged. Okay. That would be even better, no, if you can receive stem cell therapy. Okay, but the stem cell therapy that I am saying are stem cells that was sourced from humans. Okay, not any other species. You are not a rabbit. You are not a deer. Okay, so I think I mentioned a number, no. So I think it would be you would some of you who are using stem cell therapy would be familiar with what I'm saying. Okay. Stem cells, no, and stem cells should not be given oral. Okay, because if you give stem cells oral, your digestive system will destroy them. Okay, it will digest the cells. So um, stem cells should be given IV, or it can be given directly. So through injection directly to the damaged organ. Okay, so that's another one. Okay. Supplements. All right. To reduce the poisons in the body. So one poison is what? Urea. So your BUN, how do we decrease that? I also use probiotics like your Renadil. Okay, Renadil. I'm not being paid by Renadil. Okay, but Renadil is a Renadil is a brand, no, a brand of probiotics um, um, that you ingest. Okay, and the the bacteria, okay, the probiotics of Renadil consume urea and creatinine inside your gut. Okay, so the longer you take Renadil, the more you take Renadil, the more that the bacteria will consume your urea, and when they consume the urea, your blood creatinine levels and BUN levels will go down. It will go to your gut. It diffuses directly to your gut. Okay, for the gut microbiome to consume. Okay, so those are some of the things that I do. If I continue, we might not end anymore. Okay, there are other questions, so we have to give more time for other questions. But that's the general approach that I do. Okay.
So, the important thing that we want to highlight here is this, okay? Know the things that will make your condition worse, okay? So eating animal protein, animal foods will make your condition worse, okay? So a viewer asked, what about fish? So fish is dangerous because they usually have heavy metals, and your kidneys already damaged or being damaged, so don't add to that. Heavy metals will severely damage your kidneys. So at least there are many things that you can do, all right, to help improve your kidney condition. I would suggest you go for a consult with Dr. Jansen. Okay, if not, at least tonight, learn about the things that you should stop doing to make your condition worse. Okay, I want to add that you will notice that Dr. Jansen did not give a one protocol, right? It's so if your kidney is being damaged, if you have chronic kidney disease, there is usually more than one thing that is contributing to your condition. So what you want to do is that if you're looking for one drug, or take this drug and I can eat whatever I want to eat and things like that, then I think that's just not going to happen. All right, that's where I'm going to say it's impossible. Okay, that's just not going to happen. So there are many approaches that you should take, and each of them will contribute to you successfully reversing or improving your CKD condition. Okay, so just to encourage everybody, we personally, both Dr. Jansen and me, have had patients who were on the verge of dialysis. And then I remember Dr. Jansen sharing one of his dialysis patient who was supposed to go for dialysis managed to delay the dialysis by almost 2 years. That's really great. For myself, there was a patient that was about to go on dialysis, and he took a Hail Mary with the soft gel capsules. Up to today, he's still not on dialysis. So it was able to help him manage his condition, improve it so that he didn't have to go for dialysis. So I just want to share some success stories so that, we do know we give you so many options but the thing that you should be encouraged is, yeah, there are people who successfully manage and even reverse, especially early cases of CKD. And last but not least, when I was in Taiwan, I was talking to the factory, the farm where we grow our pea bars, right? And I was talking about CKD. So as you all know, a person that goes on dialysis has a shortened lifespan, and they cannot eat. They must be very careful what they eat. So the good news is this particular patient has been on dialysis for 15 years. 1-5. That's a very long time, and he is very healthy. He looks normal. He doesn't eat like a crazy person, but he still does enjoy some of the foods that he loves in a manageable amount. But he basically lives quite a normal lifestyle. So that's good news, right? That for those CKD patients who are already on dialysis or approaching dialysis, that you can have an option for a full life, right? So just go for a consult with Dr. Jansen. And for me, I will just tell you, start with the PIPA tablets, go consult with Dr. Jansen, and then he'll share with you other means to improve your condition. Yeah.
Thank you, Doc. Thank you, Sir Sean. For our next question, I am a CKD stage 3 patient. How to improve my kidney function and decrease creatinine level?
I've mentioned it already a while ago, no? So diet, be careful, no? The food that you're eating is very important. Avoid animal food products, especially meat, eggs, dairy, these things. Okay. Another one is to, yeah, you might want to try Renadil, and of course, take in PPARs. The PPAR product that I usually recommend for CKD patients is powder. Okay, not
Oh,
liquid, not soft gel.
yes.
Tablets, yes, if you chew the tablets. Okay, but powder is the way to go. Okay.
There you go.
Thanks, Doc. Another question. Doc Johnson, what really makes human body inflame? How would you determine good and bad cholesterol even if you are given diet plan?
Yeah.
Okay,
That's a good one.
good. First of all, okay, let's answer the inflammation. No? How do you know if your body is inflamed? Usually, you develop pains.
Mm,
It's easy for you to develop fever as well. All right.
mm.
Typically, if your body is inflamed, you would have allergies, a lot of allergies, different forms of allergies, different manifestations as well. No? So you can have allergies in the form of what? Allergic rhinitis, hives on your skin, no? Atopic dermatitis. You can have asthma, okay? Autoimmune diseases as well. If you have autoimmune diseases, then your body would be in a state of inflammation. If you have arthritis, joint pains, muscle pains, okay? If it's very easy for you to develop fevers as well, okay? So that would be in a state that where your body is very much inflamed. Okay, and one telltale sign is also elevation of your blood sugar levels. Okay, because your body is stressed. Right? If you don't have diabetes per se, okay, if you're not diagnosed with diabetes, say for example your blood sugar is in the range of pre-diabetes, okay, or just above normal. All right. Um, yeah. So what was the second question? Um,
Okay. Oh, wait, Doc. I'll check.
Yeah. So while you check, just I want to also say, I'm a person that is quite sensitive, and in traditional Chinese medicine, uh, some of the diagnosis is got to do with how the patient the symptoms that the patient expresses, right? So if you are always feeling warm and heaty and fatigued, that and easily tired, and like, and this one I know when I'm personally inflamed is this, when you accidentally bite yourself in your lips, and then straight away within a few hours you get a canker sore. You get a sore. That means your body is chronically pretty inflamed. So it's like it's so easy for you to have a reaction. The wind blows a little bit, you feel warm. So this are telltale signs that you are inflamed. Whereas when you are not inflamed, your body is like more stable. You don't get triggered so easily. If you eat chocolate, you won't suddenly feel like hot flushes and things like that. So that's when you will know your body is more in balance. So and if you are a parent and you see your kid, right, take some cookies and eat some chocolates and starts coughing. So it's very likely that he's chronically inflamed. His inflammation level is generally high. So you just got to watch it, right? He stands under the aircon or gets a little bit of rain and he already starts having fever. So these are just telltale signs that your system is off balance. And being chronically inflamed is a very basic way where your system is out of balance. Okay, just the second part of the question.
Okay, the second question. How would you determine good and bad cholesterol even if you are given diet plan?
Okay, good and bad cholesterol only applies inside your body. Okay, it does not apply to food. Okay, so please, please, don't be fooled by this. So where did good and bad cholesterol came from? So it came from HDL and LDL. HDL is the type of cholesterol that gets fat from your blood vessels. So that's why it was touted as the good cholesterol. Okay, LDL is the bad cholesterol because it is the type of protein that deposits fats, no, inside your arteries. That's why it was touted as the bad cholesterol. And if you have elevated LDL levels, it is the one that increases your risk of developing heart attack later on. Not just heart attack, no, basically cardiovascular diseases. Okay, heart disease, stroke, these diseases. Okay, it can even damage your kidneys. Okay? So, for food, no? If your food has cholesterol, then I'm telling you now, you don't need dietary cholesterol because the 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 cholesterol that is being produced by your liver will already give the appropriate amounts of cholesterol that your body needs. Okay? So, some people might be thinking, okay, Doc, I'm not consuming any foods with cholesterol anymore. Why is my cholesterol is still high? Okay, so just to remind you, no, dietary cholesterol can only be sourced from animal food products. Okay, it's only animal food products that has dietary cholesterol. So if you are a total vegetarian, why is your cholesterol still elevated? Okay, you're not consuming meat, you're not consuming anything, any animal food products, then it might be because of the oil that you're consuming. You might be consuming too much saturated fats. If you're consuming oil, the method how you cook your food is always fried. Then that can also elevate your cholesterol levels. Why? Why does it do that? Because your liver produces cholesterol so that it can transport the fat that you consume inside your body. Okay? It's a transporter. So that's how cholesterol works inside. No? So that's why you still have elevated cholesterol levels, even if you are not, even if you're still on, um, even if you are a total vegetarian already. So another scenario, Doc, I'm not consuming any animal food products. I'm not consuming any oils. I have zero fat or very low fat in my diet. Why is my cholesterol still elevated? What is wrong with me? the the answer is you might have familial hypercholesterolemia. So you have a genetic mutation that elevates your cholesterol. And another one is no, it might not run in your family. Okay. Then it's just that your body requires that much cholesterol. Okay? So your liver will compensate to the amount of cholesterol that your body needs. All right? So if these things are addressed, then you don't have to be afraid of high cholesterol level. And it's the LDL really the one that we should be more concerned about. Okay? So I hope you understand, no? The things that I'm saying.
Yeah, Doc, I also realized something, right? Some people with high blood cholesterol don't have the other problems that come with high blood cholesterol. That means their blood pressure is normal, they're not diabetic and everything. So I think one thing that's very important for patients and viewers is to also take note. We are often very obsessed with only one thing. We have to check for other symptoms as well, right? So that you will know overall what's wrong, that something is wrong with your body. If not, quickly just use lifestyle to adjust your whatever is lacking or in excess, right? You have excess cholesterol, cut down on your cholesterol intakes. Yeah. No, just now someone asked, is someone, or I'm not sure if the person asked or someone shared that fish oil is good for CKD patients. What's your view on that?
No, it is not. Okay, it is not.
Oh, why?
Fish oil is not good for CKD. Why? Because the fish oil out there in the market are full of heavy metals. Okay?
Oh,
And if
oh,
the product Yeah, and if the product label indeed says that it is free from heavy metals, how sure are you that they're telling the truth?
Okay, yeah, we live in a world where sorry to for anybody who's watching from China. We've seen the videos of fake cabbage, fake eggs, yeah, and nowadays, honestly, everyone, I just want to share with you, I'm not biased or anything, but my wife prefers to buy food stuff from New Zealand and Australia. She actually doesn't trust the US labeled foods. But as in Philippines, I think the average Filipino wants to trust the American, but the average Singaporean actually trusts New Zealand more than the US. So if we ever buy any organic foods, Singaporeans in general, I think, will choose Australia and New Zealand over the US. Because our impression as Singaporeans is that the US is very commercialized, and and they love money so much that we are we are more skeptical about. Whereas New Zealand people are like very straight and more traditional, so we trust their organic labeling more than the American side. So it's kind of funny, different cultures from everybody. But as Dr. Johnson does say, if certain things are really quite detrimental, quite bad for your medical condition, don't even take the risk. So, but Doc, I know for a person who's CKD who believes or recommends fish oil is because they want the omega-3 and 6s. So since you say that fish oil, there's a worry about contamination, where would you recommend patients to get their omega-3 and 6s?
Okay, good question, no? So as a principle, we want omega-3. Okay, actually six we do not want. Okay, we want
Okay.
three
Omega-3.
high. Okay, yeah, we want omega-3. So the best source of omega-3s would be plant sources. Okay, so number one, the best one of them all is microalgae. Okay, I am not being biased here, no, because I'm a guest of Simply Nature. Okay, but microalgae is the best, really, really. This is from a scientific point of view. The next would be nuts and seeds. Okay, so
Nuts.
I'll give you an example, no. So microalgae like your spirulina and chlorella are the best. If you can get them whole, then that would be better. Okay. Next would be your flaxseed oils,
Oh,
your
flaxseed.
olive oil.
Okay.
Yeah, flaxseed oils. Yeah, flaxseed oils or olive oils, your sesame oil are fine as well. Okay. So those are the relatively better ones.
Oh, there you go. And just for your information, our PPAR tablets are very high in omega-3s. So it's a good source of omega-3. So Doc, thank you. I think we managed to answer the question. I think the viewer who suggested fish oils is good for CKD probably is looking at the benefits of omega-3. So if you're very confident about your brand of fish oil, yeah. But again, here's the thing. If there is a non-oil source of omega-3s, it'll be good because as Dr. Jansen said, right, if you don't eat any dairy product, any meat product, but you still have high blood cholesterol, it's because you're taking too much oils. Even though olive oil is healthy, if you soak everything in olive oil, it's going to be unhealthy. Okay, so you got to be moderate even in those. Yeah, correct.
Okay, before moving forward to our next question, I would like to shout out our avid viewers tonight. Lily Lu from Malaysia, Luella from Iloilo, and Christine from Surigao. Your participation made today's webinar a hit. Okay, so moving forward to the next question. Aside from the food, what exercises can a CKD patient allowed to perform? Do running and basic boxing is allowed?
No. Okay.
No.
Oh,
Strenuous
no for boxing,
exercises.
right?
No, no, no. If you have CKD, the only allowable exercise intensity that can be given to you are light intensity exercise. So how light is light? Household chores is light. Walking in a park or in a mall is light. Okay. Light cycling. Swimming, that is leisurely. Okay, not competitive swimming. So you just wade in the swimming pool, then that is light. Okay, so those types of exercise are good for you, but not
Why? Why,
moderate
Doc?
intensity. Okay,
Why? Why?
it's because of the muscle breakdown.
Oh, when
Okay?
you exercise too much, your muscle break down. So the muscle breakdown will have to go
Yes.
through your kidney and
Yeah,
it will clog
creatinine
the
will
kidney
increase. Yes.
again. Oh, it will stress your kidney. Okay, does that make sense to everyone? So you don't want to rapidly break down your muscle, because if you do strenuous exercise, you are not breaking down your muscle gently. It's Meron, like you take the dam and you break the dam, it's gonna be Andwai on ETSA, right? So it is too much broken down protein at one shot, and that's gonna stress out your kidney. Okay, so that's why kidney patients cannot do strenuous exercise. Okay. That makes sense. At least we all understand now. Oh, someone
Okay.
asked, coconut water
Okay.
beneficial for kidney. I think, Doc, coconut water is actually very beneficial in
Yes.
general, right?
Yeah, in
But not
general.
the coconut
Yeah.
flesh. But not the coconut flesh, because I know that is very high in oils and cholesterol.
Uh, well, if you get the fresh coconut, it's fine. You can eat the flesh right from the
Oh, okay.
get-go. You can drink the coconut water. But here's the thing, no? If you have CKD, then you have
You are
water
not
retention.
eating down.
Do not consume fluids left and right or without proper guidance. Okay, because if you have water retention, then the amount of fluids that you can consume is limited. Okay, so I always tell my patients to measure their urine output. Uh, the fluid in no the input of fluid should be always equal to the urine output, because if the urine output goes down and your input is more than the output, then you have water retention. We do not want that. Then you have to adjust your fluid intake. Okay, it has to go down so you don't develop edema, you don't develop pleural effusion, or your lungs don't accumulate fluid, you don't develop pericardial effusion, or your heart getting filled up with water, you don't develop ascites, or your abdomen getting filled up with water. Okay, so that's the main purpose.
Okay.
I see some questions, like someone asking, can clemizine lower creatine levels? I notice everybody has this focus. If you're a CKD patient, I want to lower my creatine level. All right. So I think here there is a very perhaps we might be missing the main point, because your creatine numbers can be high for any number of reasons. So just getting your creatine levels down does not make your kidneys healthier necessarily. I mean, this is my point of view. Doc, please correct me if I'm wrong, right? So I think what's important is, tonight you should know what things can you do that will be good for your kidney. Even if your creatine numbers don't come down immediately, you're doing something good for your kidney. You could have an elevated creatine number simply because you might have an acute kidney injury. Maybe like just the person, you went boxing and you got hit in the kidneys by your opponent. That's gonna spike up your creatine levels if you incur some physical injury in your kidneys, right? So you don't want to just take a drug to lower the creatine level, right? You want to give your kidneys the chance to heal and recover. It's an acute injury, it can actually recover. So I think tonight what is important is, of course, that's a good question. I'm sure Doc will answer, does clemizine lower creatine levels? But I think what we should take note home tonight is this. If you have CKD, you should know what not to do to make it worse, all right? And then what are the supplements and other things that you can do to make it better? Whether your creatine number comes down or not, that is the end result. If you're just focusing on the creatine, you may use drugs to lower the creatine, but you're not solving your weak kidneys, right? So I think that's the best thing, the thing that should be on the focus. But Doc, maybe you can answer the question about clemizine.
Yeah. Okay. Cremizine. What is cremizine? Cremizine are spherical granules that you take to absorb creatinine. Okay. The cremizine will absorb your creatinine so that you excrete the excess creatinine through your stool. That's what cremizine is. Cremizine is a mainstay in all patients with CKD because cremizine will delay initiation of dialysis. Okay, we do not want elevate too much creatinine inside our body because that is a poison. Okay, It should be excreted. And one way for us to eliminate creatinine is by way of taking this. No, it's you'll be able to excrete creatinine through your stool through this meal. Okay.
So, Doc, it actually means that when we take drugs like cremazine, you are lowering the creatinine so that you don't become toxic enough that they require you to go for dialysis straight away. But it
Yes,
actually
correct.
doesn't. But it doesn't reverse your kidney
It
condition.
doesn't. It
Okay,
doesn't.
see,
Yeah.
guys. So this is the thing that I really want to make clear to everyone, right? So the answer is yes, cremazine lowers creatinine, but it doesn't heal or strengthen your kidney. It's the other things that Dr. Jansen have talked about tonight that will reverse and improve your kidney condition, right? So yes, take your cremazine, but you have to follow the advice of Dr. Jansen regarding the foods that you should avoid, the other protocols that you can do. If you want to know more, just arrange for a consult with him. Because, like I said, the drugs delay your need for dialysis, but it doesn't heal or improve your kidney condition. All right. No, I think this Amante actually typed this question twice. So I think she really wants this answered. So I think, of course, I understand because it's her son. She wrote that my son is 8 years old. His creatinine started to increase in September 2023. He reached as high as 173 and now is only 72. Is this already CKD?
Okay. So it elevated to 1.7. Yeah, 1.7. No, but it decreased to 0.7. Am I correct?
Yeah, it seems like it. Because she said now it's only 72. So I assume it's not a typo. She didn't miss a 1 in front. So it dropped by 100 points. Yeah.
Dropping by 100 points. So if so low, then that is reversal. Okay. Creatinine,
Yep.
I don't know what you're doing, but if you're not, if your son is not on dialysis, you're not doing anything to artificially pull down the creatinine. That then a point 7, 0.7 creatinine level. So it's a creatinine level that is normal, even for that age. Okay?
So there you go. So for Miss Amante, I think the answer that I hear is that based on the facts that you gave us, just these two facts, your son is not having chronic kidney disease. He probably had some, he probably had an acute kidney injury.
Yes, correct. Correct.
Right, that gave him a spike in his creatinine, but then it came down, which means it's reversed, it's recovered. So it's not chronic, right? It's not like a permanent thing. It was a temporary one. So that's good news. But again, if you are not 100% feeling, how shall we say, confident, have a consult with Dr. Jansen, all right? Then you will be sure, for sure. Doc, there's another one. I think this one is back to what we are talking about, right, Doc? It says, if the CKD patient goes down, the creatinine level goes down, would it be possible that the kidney is in the healing process? I mean, for me, it's yes and no, right? You got the creatinine level down. Is the kidney healing? We don't know. It could still be just hurt, but because of the drugs you take, the creatinine levels are down, right? So, but it could also mean that the kidney is recovering. So we need to see the trend, right? We need to see as time goes by, do you show other symptoms? How's your urine levels? How's the other things, other symptoms that make you think or show that you have CKD? Are those symptoms no longer showing up? If they're no longer showing up, then yes, your kidney is likely to recovering. And of course, if you manage to bring your creatinine levels back to normal, for example, through drugs, you give your body the opportunity to heal. So that is why Dr. Jansen said, please take the drugs that you've been prescribed, okay? So that he can then start to do the other protocol to be able to heal your kidney. So in other words, it's a good thing when your creatinine levels come down. It's just an opportunity to really do something to get the kidneys to heal. To make sure that your kidneys are healing, go for a consult with Dr. Jansen so that you can know for sure.
Okay. We receive a great question, and most of the gym rats can relate. Is taking whey protein and creatine monohydrate can damage my kidneys?
Absolutely yes. Okay, I've had one.
Oh no.
Yeah.
Oh
Oh
no.
no. Oh no. But I've had one classmate in med school
Okay, yeah.
who drank whey protein. Uh, I think he was consuming 1.5 liters of whey product, no, per day. So 1.5 liters approximately.
No.
That would be around 6 scoops, no, of 6 scoops per day. He developed proteinuria, I guess what, no?
Oh
So
my God.
he was shocked, no, and the nephro told him that yeah, it can damage his kidneys, and it's really true, no. If had he Yeah, he also realized the reason why he went for the urinalysis is because his urine is bubbling. There's
Yes,
a
yes, yes,
foam
yes.
there's foam
Yes.
already in the toilet bowl, so that's the one that was alarming for him, no. It's really it looks like he did laundry in his toilet bowl. It's
Oh,
that bad. Yeah, so for whey protein, where do we get whey protein from? It's from milk, it's from dairy. It's an ultra processed dairy product. Okay? In fact, no, when you have whole milk, um if you process that, you can turn that into cheese. Okay? From cheese, you can turn that into whey. So cheese is already very processed. It's an ultra processed food item already. Whey is even an ultra processed food product. So it's a no-no. Okay, if you are someone who has kidney damage, don't drink any food or any supplements that has whey protein. Okay, it will damage your kidneys further. For creatine, it's the same. Creatine is basically the same as creatinine. Okay, creatine is mainly used for to give you that initial um, boost in energy, so you can lift heavier weights, you can lift more repetitions. If you have properly functioning kidneys, then taking creatine is fine. Okay, as long as you follow the dose, okay, that is on the label, then that's fine. Then just drink lots and lots of water. If you have kidney damage already, don't take this supplement. Okay.
So to all the gym rats out there and to the viewer who asked this question, okay, to all our viewers tonight, okay, when you pee, I guess especially for ladies, because for guys it's very natural. When we pee, we look at our pee, and we also look at the result of our pee because we are staring at it, right? So one thing is very important, all right, when you wake up in the morning, when you pee, is your pee bubbling? If you went to Vikings, for example, you went to Vikings and you ate like crazy, or like for me and Doc Jansen, we went to Cafe Ilang Ilang at at Manila Hotel, all right? When we go back that night before you sleep, when you take your last pee, if you see lots of bubbles, you tomorrow is a good day to fast because it really meant you overload, you took in too much. It's And if the color is off, if your urine is ever cloudy in color, that's a symptom that something's not right. Okay, so the first thing that when something's not right, that is we stop taking all the nonsense. So at least immediately for that day, suddenly just eat Quaker oats until you get the chance to see your doctor. Stop eating all the nonsense food until you see your doctor. If for me, if my urine actually bubbles, I will be worried. Oh, is it because of the heavy dinner or taking too much this large piece of steak this afternoon? So I will definitely watch my urine for the next few days. If there are no more bubbles, then I'm like, okay, it was most likely I really ate the wrong choice of food and I watched myself, right? But if this is still continuous, then definitely. So if you're a gym rat, you're taking all this creatinine and whey protein. If you go to the CR immediately after this program, you pee and you see lots of foam or bubbles. When you pee, the bubbles don't just burst immediately, it stays there and float, even if it's not like soapy. Then you should know, you know what? First thing I want to do is this. Tomorrow and for the next 1 week, I stop my whey protein and I check. If my urine no longer bubbles, then you obviously know your whey protein is causing your urine to bubble. And that is not a good sign, right? So I think with that, I'm sure you know what to do for yourself after that.
Thank you, Doc and Sir Sean. I am actually guilty on taking whey protein, but I only take 2 scoops
Okay.
after every time I do my workouts. But yeah, I have to
Yeah,
be
so
my
watch your urine, right? Okay, so for ladies,
okay.
you actually have to get up from the toilet bowl and look. All right, for guys, it's very easy. So the moment we see some symptoms like that, we quickly correct what we're doing. Yeah.
Okay, we are almost at the end of the webinar, and this will be our last question. This is not actually related to CKD, but I think this is a great question to handle. Um, this came from our viewer. Which PPARs should I take? I'm about to go for a surgery to remove my cyst, abdominal part. Also, I am pregnant and I am on my second trimester.
Oh, okay.
Yeah,
Doc,
I will. Yeah, you can. I have to know what kind of cyst, no, that you have. Is it an ovarian cyst? Yeah. So if yeah, it depends on what kind of cyst, no. But if it is, then you can choose between liquid or powder. But for me, I think it will be better if you go for the powder. Okay. It's just that one reason is because it has better absorption, and since you're pregnant, um sometimes, because of the, enlarging fetus, you can have digestive problems. So yeah, just go for the powder. It would be better absorb that way.
yep.
Okay, thank you, Doc. I can see a lot of questions coming in, but if you have any follow-up questions, don't worry, we will answer each of your question next webinar or via direct message. As we draw the curtains tonight, conversation, kindly give our viewers your parting words, Sir Sean.
Okay. My parting words will be: it's the beginning of the new year. This is when our conviction and willpower is the strongest, right? They're making some New Year resolutions. So I pray that everybody aim to have a healthy body this year. So you can do it and still enjoy yourself. And for me, I started off this year I losing 11 pounds. Okay. I actually, in the process of losing 11 pounds, I eat at a restaurant almost every day. Uh, I was just able to do this because I select my food that I order very carefully. So my favorite restaurant is actually Putian, which I want to bring Dr. Jansen and his family to eat. Okay, and every time I'm there, I order homemade tofu, very very nice, and they have this Chinese spinach in superior sauce, right? So it's just, and it's very filling, and it's so delicious, and it's pure vegetable. There literally is no meat there. But I'm very happy with that meal, and it's so tasty, and yeah. So I just want to encourage everybody, we can live healthy and enjoy our meals tremendously. And of course, once in a while, within a week, I will eat things like a wonton soup, which contains pork dumplings, right? So I do get my little fix here and there. But, you can do it. So I'm wishing everybody a very healthy 2020.
Thank you, Sir Sean, for that inspiring message for everyone. How about you, Doc Johnson? Do you have any parting words for our viewers?
Yeah. It has been a very productive webinar tonight. So we've discussed a lot of things, and some of you might have information overload already. And
I'm sure.
yeah, so well, as what they say, no, if we keep on doing things, no, it's the time that it's when it sticks to us. No, that's when we learn. We really learn. So I'll just repeat what we've discussed tonight. So for CKD patients, no, always remember: eat right, take your medications. Okay, if ever you have to exercise, exercise very light only. Okay, supplements can be beneficial. All right, we do not um, just turn all supplements away. Okay, no, because there are a lot of supplements that we can use that can help you. All right, yeah. So that's it. Those are the tips that I can give you. Um, If you want to, delay the initiation of dialysis, if you're already at that stage of CKD, oh my gosh, follow these tips, right? So there you have it. Thank you everyone for listening and watching tonight.
Okay. For our viewers tonight, we hope to see you all in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, January 18, we are going to have a special presentation about natural solutions for colon cancer with Doc Johan Mañez. And for special announcement, I am happy to invite you to our most awaited health conference for cancer patients, led by our cancer experts, entitled Innovative Modalities for Cancer Treatment, that will be held again at SMX Convention Center, Aura, this coming March 16. Don't miss the chance to have a Q&A and get answers to your cancer concerns. Once again, thank you for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health and your victory over cancer and metabolic diseases is what keep us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.